So in the today class, we'll be discussing how to write the principle. In that, you have to mention the 4 points. The exam, not write all these 4, will not get the full mark. 5 marks, you have to write all these. All normal range and the clinical significance. In this case, all the experiment, whatever you have performed regarding all these, yes, given from the right. Even in your answer book, you have to write the same thing, like blood glucose sample by this is experiment name, right, like this. Now blood glucose in given sample by POD and the core principle I have shown here, the core principle. So in the principle, you have to write the glucose water plus is it form H2O2 plus H2O2 again break down to the nitrogen plus water in the and that is the phase that will break down H2O plus innocent oxygen combined with amino.
Sir, Suni and Ramber is there.
Okay, I'm recording the lecture so you can go through that.
Sir, Sunnian sir.
Yeah, but your voice is so clear.
Sir, earphone, headphone की
volume of the sound is low.
earphone, headphone की लावता हम सर आज.
Are you able to hear me?
No, sir. The volume of the sound is too low.
Okay, I am recording the lecture so you can go through that. That will be, I think, audible. Okay. So oxygen plus phenol plus 4-amino-phenazone, it forms the pink color complex. After writing this, also you have to mention the intensity of color is at 540 nanometer. The core principle. Okay. The core principle that you have to mention. Then normal lens, you have to mention all these 3: fasting, prandial, and the random blood group. 10 mg cordial, 10 to 150 mg cordial, and the RBS 70. Then the clinical significance, you have to mention hyperglycemia and the hypoglycemia. And at least 3 or 4. You are not able to write all the clinical significance. At least 3 or 4 you have to mention. Hyperglycemia and the hypoglycemia. Diabetes, hyperadrenaline. Okay. Here it's a 5, you can mention the 4, at least 4, or if you are not mentioning 3, you can mention. Okay. Overdose, hypothyroidism, hypoadrenaline, hypogenesis. The clinical significance of that you have to mention. Topic. Then only you will get the 5 or 5, 4, 5 you will get. Get that you have to mention experiment name, that was measurement of blood glucose by glucose. Another experiment is estimation of serum total examination, and you have to mention like this: estimation of serum total protein given sample by bioreactor. So the name of the method you have to mention, and the principle like this you have to mention. So peptide bond present in the protein react with copper sulfate in alkaline medium to give purple or violet color. And if you mention this structure, it will be the how copper bond amino group of, and intensity of color is equal to the concentration of total protein is measured at 540. So this core principle you have to mention. Okay, this is 1 mark, this is 1 mark. Like this will be 2 marks, this is 1 mark. Heading is 1 mark. Length 1 mark. 8 gram. Then you have to mention the clinical significance in the two heading, that is the hyperprotein and the hypoprotein. And the hyperproteinemia, myeloma, infections like malaria, Kala-Azar. Hypoproteinemia, liver disease, vascular, marasmus, malabsorptions, and like this you have to mention. You are getting the question of the total things you have to mention. This 4 heading you have to mention. 1 marks principal, normal length is 1 marks, and the 2 marks. You have the 4 marks, and total is the 5 marks. Okay. Another is the estimation of the serum albumin, and also you have to calculate the AG ratio. AG ratio and estimation of serum albumin. So in this you have to mention the heading, that is estimation of serum albumin by dye binding method. Dye binding method. Principally you have to write albumin present in serum sample bind to the albumin measured at 620 nanometers. Your color is directly proportional. This you have to mention 620 nanometers. Yes, albumin length 3.5 to 5 gram per deciliter. Clinical significance you have to mention, that is hyper and the hypo dehydration, diarrhea, and the vomiting. Hyper the condition causes the decreased albumin level, absorption, here are the conditions. You have to mention the exam. Last one, that is estimation of the serum total cholesterol. In this also you have to mention the 4th experiment name and the clinical. Estimation of serum total cholesterol in the given sample by Jack methods. Principle you have to mention in this way. SO4 it forms dione, and again with the help of the same acid is from, and again by the same S2SO4. So the oxidation sent to green sulfuric acids. This is treated with the very color in form of color. It is copper 549. Color is directly proportional of cholesterol. You have to mention in this way and get the normal length 150 to 250 mg per deciliter. Clinical significance. These conditions and the conditions: syndrome, diabetes, hypothyroidism, and the decreased by the thyrotoxicosis. Absorption, the conditions where is in. So these are the experiments you have performed during your first year. Second semester, these are the experiments you have performed. So as I mentioned you have to mention all these 4. I will upload this slide. So go through that. 4 things you have to mention. Experiment name, core principle, normal range, and the clinical significance. Then only you will get the full marks. Otherwise, if you miss one, as I told, this experiment is 1 mark. Core principle is the 2, normal is 1 mark. 3, 4, and 5. Will be any of these. I don't think the principal means only the core principle. Here we have divided 5 marks, so you have to mention this 4. Then only you can get the full mark. If you have any doubt, you can ask me. Any doubt? Slowly?
No, sir.